Looking at diabetic foot ulcers. Foot ulcers are a common complication of diabetes that is not being managed through methods such as diet, exercise, and insulin treatment. Ulcers are formed as a result of skin tissue breaking down and exposing the layers underneath. They are most commonly under your big toe or the balls of your feet, and they can affect your feet down to the bones. If you are diabetic, please discuss any food concerns with your doctor to ensure it's not a serious problem, as infected ulcers can result in amputation if neglected. Identifying symptoms and diagnosis. One of the first symptoms of foot ulcer is drainage from your foot that might stain your socks or leak out in your shoe. Unusual swelling, irritation, redness, and odors from one or both your feet are also common early symptoms. The most visible sign of a serious foot ulcer is black tissue called ischia surrounding the ulcer. This forms because of an absence of a healthy blood flow to the area around the ulcer. Partial or complete jamming, which refers to tissue death due to infections, can appear around the ulcer. In this case, odorous discharge, pain, and numbness can occur. Signs of foot ulcer are not always obvious, and sometimes you won't even notice until the ulcer has become infected. So talk with your doctor regularly if you begin to see any sign of skin discoloration, especially tissue that has been turned black, or feel any pain around an area that appears calloused or irritated. Your doctor will likely identify the seriousness of your ulcer on a scale of 0 to 5. Using the Wagner ulcer classification system, 0 means no open lesion. 1 is superficial ulcer without penetration to deeper layers. Scale 2 is deeper ulcers reaching tendon, bone, or joint capsules. 3 is deeper tissue involved with abscess, osteomyelitis, and tendonitis. 4 is gangrene in a portion of the forefront or heel. 5 is extensive gangrenous involvement of the entire foot. Causes of diabetic foot ulcers. Ulcers in people with diabetes are most commonly caused by poor circulation, high blood sugar, that's hyperglycemia, nerve damage, irritated or wounded feet. Poor blood circulation is a form of vascular disease in which the blood doesn't flow to your feet efficiently, so poor circulation can also make it more difficult for ulcers to heal. High blood glucose level can slow healing process of an infected foot, so blood sugar management is critical. People with type 2 diabetes and other ailments often have harder time fighting off infections from ulcer. Nerve damage. Nerve damage is a long-term effect and can lead to a loss of feeling in your legs. Damaged nerves can feel tingly and painful. Nerve damage reduces sensitivity to foot pain and results in painless wounds that can cause ulcers. Ulcers can be identified by drainage from the affected area and sometimes a noticeable lump that isn't always painful. What are the risk factors for diabetic foot ulcer? All people with diabetes are at a risk for foot ulcer, which can have multiple causes. An infection is a serious complication of a foot ulcer and requires immediate treatment. Infection of a foot ulcer can be prevented with foot baths, disinfecting the skin around an ulcer, keeping the ulcers dry with frequent dressing changes, enzyme treatment, dressings. You might also need medications from your doctor, so you need to see your doctor for medications. How can you prevent foot problems? According to a 2017 review article in the New England Journal of Medicine, more than half of the diabetic foot ulcers become infected. Approximately 20% of moderate to severe foot infection in people with diabetes lead to amputation. Therefore, preventive care is crucial. Closely manage your blood glucose, as your chances of diabetes complication remain low when your blood sugar is stable. You can also help prevent foot problems by washing your feet every day, keeping toenails adequately trimmed but not too short, keeping your feet dry and moisturized, changing your socks regularly, and wearing proper fitting shoes. Please note, foot ulcers can return after they have become treated. Scar tissues can become infected if the area is aggravated again. So see your doctor if you begin to see blackened flesh around the area of numbness. Foot ulcers, when caught early, are treatable. Untreated infections may require amputation. While your ulcers heal, stay off your feet. Follow your treatment plan. Diabetic foot ulcers can take several weeks to heal. Ulcers may take longer to heal if the blood sugar level is high and constant pressure is applied to the ulcer. Remaining on a diet that will help you meet your glycemic target, and offloading pressure from your feet is the most effective way to allow your foot ulcers to heal. Once an ulcer has healed, consistent preventive care will help you stop an ulcer from ever returning. If you like our videos, kindly comment below, subscribe, turn on the notification bells so that you get our videos as they drop.